We're going to talk about what is an atypical dog. We're going to have a brief look at canine psychopathologies. We're going to look at the canine emotions of fear, anxiety, frustration, and anger. So the behavioural activation system, this is the inability to inhibit responses occurring. So what happens is the individual is so driven to seek out the reward and they have almost no ability to inhibit their responses. And so we refer to that as an individual that's very impulsive, but it's not the dog's fault that they can't ignore that toy that's on the ground. The impulse is so strong and their ability to inhibit it is not very present, and so that dog's really going to struggle in that situation. We have to really break things down to a very, very minuscule level for that dog to be able to develop some skills to help them with their impulsivity. So common issues include when we've previously consistently rewarded a behaviour that's now unwanted. So maybe that's as simple as a dog that's been walking down the street. Every time they've seen a dog, they've been allowed to sort of cry, whine, pull. They pull on the leash. They eventually pull all the way over and chat to the dog. So they're receiving the reinforcement for doing that. But then we decide at some point we don't want to do that anymore. That prior learning is going to impact how difficult it is for us. And remember, some dogs are not good with extinction learning. So it's going to impact on how difficult it is for us to now change those behaviours. If our dog genuinely does struggle to learn, has significant setbacks, I mean, we always know in training there's going to be some ups and downs, but has significant setbacks, cannot adapt to novelty no matter how carefully you introduce novelty, is extremely anxious to the point where it is affecting the quality of life, then I would absolutely suggest that you seek out the help of a veterinary behaviourist or a vet with expertise in behaviour to help with that dog.